The most effective fixes would be moving to a single payer system or standardized payment methods nationwide like they do in European countries, but I do think there's value in a system that has more payers, so that's not the route I would choose to go. Reducing complexity is the key in a multi-payer system. Electronic health records, EHRs, were supposed to reduce complexity by automating certain tasks, but so far that hasn't been the case because of a lack of standardization. Providers and EHR developers don't have an incentive to standardize or increase interoperability because they want to keep people within their own systems. But also it brings up a health privacy concern under HIPAA. That means government, specifically CMS, needs to lead that charge in developing a standardized format. Medicare has the power to establish protocols and then make all EHR vendors, insurers, hospitals, and doctors get on the same page. So when all is said and done, I actually think it is possible to create a market-driven healthcare industry that not only works, but works significantly better than the systems they have in other countries. I put my preferred fixes in order from most crucial to least important here. Target hospital monopolies with antitrust lawsuits, end the employer-based insurance system, and encourage healthy people to get insurance. My preference is to tax business-provided health benefits, give businesses a one-time extra deduction for related salary raises, give individuals a deduction for their premiums, and give health insurance subsidies for people who have health indicators within a healthy range. Require all electronic health records to talk to one another, and have Medicare take the lead in setting electronic reimbursement standardization and automation across the industry. Require that all hospitals publish the pricing on their most common procedures and services in a standardized format. Get rid of the influence of the AMA in setting their own Medicare rates by changing the CMS RVU setting process, and adopt an ethics statement. And in the case of conflicts of interest within commonly owned hospitals, physician practices, and labs, require disclosure and an additional external referral. So how well do the existing policy proposals deal with the problems I've laid out? The first idea is to open Medicare to anybody who wants to buy in alongside existing insurance. Medicare negotiates significantly lower prices with hospitals today, so hospital pricing power wouldn't be an issue whether there are local monopolies or not. The big question to me is, would private insurance have an incentive to control prices? You could argue that to stay competitive with Medicare, insurance companies would need to bring down prices, and I think that's true for people who aren't buying insurance through their employer. But employers subsidized 82% of premiums in 2019 on single coverage, so I think you'd only see a marginal change in the employer-based insurance market, which is the largest share. Price visibility and conflicts of interest would probably stay the same, again, not impacting the employer-based market. We'd probably be able to control admin costs a bit too by decreasing the number of payers slightly, but more importantly by opening the potential for standardized payment processes that would be near impossible today. Overall, I think this would be an improvement, mainly for the individual market and uninsured people, but you need to disrupt that employer-based model in some way for this to really fix the system. So how about Medicare for all? This does deal with all the problems I've mentioned, mainly by just getting rid of all private insurance altogether. You also get equity and the most efficient system in terms of admin costs. On the downside, you're stifling innovation, granting significant economic power to the government, reducing choice, and causing severe disruption in the short term as far as eliminating an entire insurance industry of jobs and adding to the government budget. When you compare multi-payer versus single-payer healthcare systems in the countries most similar to the US, public-private multi-payer systems similar to expanded Medicare tend to outperform single-payer systems like Medicare for All in terms of wait times, but there are exceptions and nuances among systems that make them really tough to compare. If I'm ranking all potential solutions, my market-based solution with the fixes I proposed is first. Second is expanded Medicare with some sort of a fix to provide employer-based insurance competition, and there are a bunch of ways you could do that. Third would be Medicare for All. Fourth is expanded Medicare that's only targeted to the non-group insurance market. And fifth is any sort of market-based solution that leaves the employer-based insurance model or local hospital monopolies intact. Some problems I've pointed out have already gotten lots of press, but there are others, like the biggest core problems, that get almost no press. Politicians have been flipping us a manipulated story, and they have huge incentives to do that. Huge dollars coming in from the hospital and physician lobbies, but on top of that, it's just an easy story to blame greedy insurance company profits for our problems, especially when the alternative is calling out hospitals, many of them nonprofits. This is a complex issue, and we always need to be skeptical of the easy explanations and solutions that we get from politicians. Thanks for watching. Hey, if you found this video interesting or useful, please give it a thumbs up, put a comment below, and subscribe to my channel to get any updates on new videos. If you didn't like it, you should probably go ahead and put a comment below too to let everybody know. Either way, thanks for watching.